Hello, everyone. My name is Cody Douglas, and today I will be discussing narcissistic personality disorder, otherwise known as narcissism. Throughout this presentation, I'll be discussing the diagnostic, theoretical, clinical, and scientific elements of the disorder. Without further ado, let's talk about diagnosing narcissistic personality disorder. In this section, I will mostly be referring to the DSM-5's diagnostic criteria while discussing the diagnosis of narcissism, though I will also include some passages from the DSM-3 to show the diagnostic criteria for narcissism has changed over time. In order to remain coherent and concise, I will read one of the 9 diagnostic criteria for narcissism exactly as it is written, so you can get an idea of the language the book uses, talk about what the criteria exactly means, then offer an explanation for the next criteria. To be diagnosed with narcissistic personality disorder, one needs to display at least 5 of the 9 following traits. In the diagnostic process, professionals will look to see if their patient has a grandiose sense of self-importance, e.g., exaggerates achievements and talents, expects to be recognized as superior without commensurate achievements. Simply put, they're checking to see if their patient has an inflated sense of self and achievement. That isn't to say that people who display this criterion are experiencing psychosis. They simply believe that their accomplishments are astounding and well-earned, and that everyone else is less capable than them. Take running a mile, for example, here. Someone with narcissistic personality disorder would probably be impressed with themselves for running a mile, and they would expect that everyone around them would be equally impressed. However, they would think of running a mile as less of a feat if someone else was running it. It's also worth noting that this sort of thinking applies when working with others. In their mind, a person with narcissistic personality disorder always does the bulk of the work, and they do it better than everyone else too. In checking for narcissistic personality disorder, experts are also checking if their patient is preoccupied with fantasies of unlimited success, power, brilliance, beauty, or ideal love. Because people with narcissism think they're destined for greatness, they think a lot about how it will feel once they get what they want. We can basically think of this criterion as a really ambitious, planless goal. Someone displaying this criterion will want to be the best at something, or have the most of something, though they probably aren't going to be putting any working into achieving their desires. In their minds, they already deserve whatever they want. The third criterion for diagnosis is the patient believes that he or she is special and unique and can only be understood by or should associate with other special or high-status people or institutions. This means that since the patient is the greatest person in the world, they want to surround themselves with their equals, or at least people who are closer to being equal than most. This one is pretty self-explanatory, though I will say that their desire for prestigious companions also extends to the institutions they associate with and the services they solicit. In other words, they want to be around successful people and nice, usually expensive things. Someone with narcissistic personality disorder, also requires excessive admiration. They already know that they're the best, but they need to hear it from other people too. Often the main goal of any interaction they have with another is to get confirmation that they are great. When this criterion is present in a patient, it means that their self-esteem is based on the opinions of others and therefore quite fragile. A person with this disorder also potentially has a sense of entitlement, i.e., unreasonable expectations of especially favorable treatment or automatic compliance with his or her expectations. In essence, they expect that things are going to go their way and that others should be willing to inconvenience themselves to make sure they do. They may expect products and services for free, for others to forfeit their property or time, or to be held to a different standard than others. In addition, professionals will check if their patient is interpersonally exploitative, i.e., takes advantage of others to achieve his or her own ends when diagnosing narcissistic personality disorder. This exploitation can be unwitting or conscious. so it doesn't necessarily have to be malicious. A person with the disorder may just expect that the people around them would want to help them, regardless of the personal cost. Of course, this criterion can manifest in a more mean-spirited, conniving way. Someone who displays it may form a relationship when it seems useful and sever it when it no longer serves their purposes. Additionally, the DSM-5 states that a person with narcissism lacks empathy, is unwilling to recognize or identify with the feelings and needs of others. People with this criterion don't recognize others as fully conscious beings. They don't care to hear about others' thoughts and feelings and will generally take them as a sign of weakness when expressed. After all, they believe that everyone around them wants to, or perhaps solely exists to, serve their interests. The next criterion is used to check if the patient is often envious of others or believes that others are envious of him or her. In cases where a patient does not have everything they want, which can mean just about anything, they can feel jealous of others for their wealth, status, fame, family, and basically anything else. Likewise, they may believe that others covet their features, possessions, relationships, or successes. Since people with this disorder think that they're the greatest and deserving of everything, it's no wonder that their inferiors desire and are perhaps even working to deprive them of their property and achievements. The ninth and final criterion for the DSM-5 explains if a person with narcissistic personality disorder shows arrogant, haughty behaviors or attitudes. Basically, they're rude to people, especially when they feel like their self-concept is being attacked. For instance, a person with displaying this criterion may insult a waiter if their service is subpar or perceived as subpar, which makes sense when you consider that they interpret anything but praise as a slight, and even sometimes praise as a slight. Before I move on from this section of the presentation, I want to briefly mention how the current criteria for diagnosing narcissistic personality disorder differs from the criteria in the DSM-3. I found that the major difference between the two sets of criteria is that there previously wasn't any information about the prevalence or gender ratio of narcissistic personality disorder. Even then, I didn't find this new information to be that useful. The DSM-5 gives a wide, variable estimate for that data. Beyond this change, the criteria for both editions are rather similar, though it is worth noting that the 5th, 6th, and 7th criteria in the DSM-5 were all potentially optional sub-criteria for Criterion E in the 3rd edition. It's also worth mentioning that each criterion in the DSM-3 is given its own paragraph and independent explanation, where the DSM-5 introduces criterion in a flowing way that helps to show how one criterion is almost guaranteed to be the symptom of another. Also, another sub-criterion that checked for relationships that characteristically alternate between the extremes of over-idealization and devaluation was removed from the 3rd edition, and the criterion that checks for arrogant, haughty behaviors was added to the DSM-5. Ultimately, the criteria for narcissism hasn't changed much in the 33 years between editions. Now on to theory. Now that I've talked about the DSM's criteria for narcissism, I'll spend some time explaining the potential causes and risk factors associated with narcissism. I'm going to talk about the etiology section of our book as a basis, but I'll weave in external research as it's useful. So our book lists 2 potential causes for narcissism: parenting and self-esteem. For the parenting perspective, it proposes that people with the disorder had parents who told them that they were superior to other children, indulged them too often when they were kids. I looked into this proposal with the research article Origins of Narcissism in Children, which works as a convenient talking point, because it also lets me discuss how narcissism is viewed and explained through an alternative approach, psychoanalytic theory. Where the social learning theory of our book suggests that children can become narcissistic because their parents overvalued and overpraised them, psychoanalytic theory holds that children become narcissistic to gain the attention of indifferent, distant, or otherwise cold parents. The study tested the validity of these 2 proposals about the origin of narcissism by measuring levels of the narcissistic personality trait, levels of self-esteem, levels of parental warmth, and levels of parental overvaluation among 7 to 12-year-olds. The results of this study support the framework of social learning theory, that parent overvaluation is correlated with higher levels of narcissism, while parental coolness does not result in increased levels of narcissism. Despite the soundness of this conclusion, other researchers have criticized this work by noting that the trait of narcissism does not directly translate to adult narcissistic personality disorder, and even the original researchers emphasize that narcissism appears to be partly caused by a genetic component and other environmental factors. The other position in our book suggests that individuals with narcissistic personality disorder base their self-esteem on the validation of others. This theory was proposed by Heinz Kohut and is a component of self-psychology, which is itself a variant of the psychodynamic theory of Freud and his followers. Where the psychoanalytic theory that I discussed earlier proposes that kids become narcissistic due to a lack of parental warmth, this theory suggests that some psychological issue from childhood reemerges. I must confess that I had some difficulty understanding the psychodynamic language Kohut used, but I was able to comprehend his work fairly well after reading a critique of it by Orna Efek. Simply put, Kohut said that a narcissist is someone with a weak concept of self, who relies on others' opinions to craft a self-image. If Kohut's theory is correct, then it's no wonder that a person with narcissistic personality disorder would have a temperamental self-esteem. It's also worth noting that this theory has a neurological basis as well. The study, Narcissist Social Pain Seen Only in the Brain, demonstrates how those with high scores on a scale measuring narcissism display greater activity on the brain's social pain network than people with low narcissism scores. The experimenters asked subjects to fill out a narcissism personality inventory, then used functional magnetic resonance imaging on subjects during a ball game, where they would be rejected by their peers. Those with higher levels of narcissism on their narcissism personality inventory self-reports showed exaggerated neural responses in parts of the brain that make up the pain circuits, the dorsal anterior cingulate cortex, subgenual anterior cingulate cortex, and anterior insula. While this study doesn't confirm that the key component of narcissism is a weak self-concept or weak self-esteem, it strongly suggests that the need for others' validation is an integral part of narcissistic personality disorder. Narcissistic personality disorder is often accompanied by substance use disorder, major depressive disorder, interpersonal problems, an increased risk of self-harm or suicide, and other mental disorders. While medication may be useful in treating some of its associated symptoms, the best treatment for adult pathological narcissism currently appears to be therapy. One approach to treating narcissism is psychotherapy, which involves targeting the maladaptive thoughts, emotions, and behaviors of narcissistic personality disorder. With this approach, a therapist talks with their patient to sort out their issues, though what the therapist believes to cause narcissism may alter the course of this psychodynamic form of treatment. For instance, therapists that think Kohut was right about narcissism will probably adopt his self-psychology approach, and will see treatment as the process of fixing their patient's self-esteem and helping them gain a better understanding of empathy. Or in cases where therapists believe that narcissism is a response meant to counter neglect as a child, they may take an attachment-oriented approach that encourages their patient to consider the emotions and experiences that underlie their narcissistic behavior. Less frequently, cognitive behavioral therapy is also used to treat narcissistic personality disorder by challenging patients' schemas of superiority and entitlement, or patients' childhood neglect, to modify behavior. Overall, therapy is the best form of treatment for narcissistic personality disorder, though its usefulness is dependent on patients' willingness to seek out and comply with treatment for their disorder. Prevention is preferable to treatment here. Parents may be able to reduce their child's risk of developing narcissistic personality disorder by showing affection without implying that their kid is superior to anyone else. With that said, high levels of narcissism are fairly common among children and adolescents, and a narcissistic kid probably won't develop the disorder. To finish off this presentation, I'll be talking about Brumelman, Nikolic, and Bogle's research article, What's in a Blush? Physiological Blushing Reveals Narcissistic Children's Social Evaluative Concerns. This study was conducted to determine what physiological blushing reveals about children who score high in narcissism, as blushing is a physiological indicator of vulnerability that cannot be falsified or prevented. As narcissists often do not report when they feel stressed or threatened, blushing allowed researchers to see a better representation of how narcissistic children are feeling. To measure blushing, the study measured each child's changes in blood volume, changes in blood pooling in arteries, veins, and capillaries, and skin temperature after giving children heavy, moderate, or no praise for singing a song. In addition, children completed a narcissism personality inventory to allow researchers to check for a correlation between blushing and narcissism, and reported how much they thought they blushed after singing. In total, 105 7 to 12-year-old children from the Netherlands took part in the study, and 44% of the children involved in this research were male. When the study concluded, researchers found that children who scored high in narcissism blushed when they received only moderate praise, but denied doing so in their self-reports. This blushing may be the result of a discrepancy between how narcissistic children view themselves and how they believe others perceive them, as non-narcissistic children did not blush when they received moderate praise that accurately assessed their performances. The researchers also suggest that the narcissistic children denied blushing either as a way of saving face or because they are genuinely unaware of their physiological responses. Additionally, this research may provide evidence that grandiosity and vulnerability fluctuate within narcissists, as the children who blushed the most denied blushing the most. The researchers concluded by noting that modest praise appears to threaten narcissists' self-image, though they do note that future research on this subject could benefit by using neuroimaging as a more direct measurement of vulnerability, gathering subjects from a greater variety of countries, and including a greater variety of differently aged participants. And with that said, I have finished my presentation on narcissistic personality disorder. Thank you for watching.